Greetings, my fellow pediatric nurses, L&D nurses, and for all of my first-time parents, including myself. So let's do this, guys. Let's dive into this. At birth, you got to remember your baby will be placed directly on your chest. So at this time, your L&D nurse or healthcare provider will dry your baby, clean everything up, all the chrome, and immediately, what they'll do? They'll check again. Baby will be covered, and you will be covered with a nice warm blanket. That way, you can get therapeutic connection of your bare skin, baby lying directly on your skin. What do we call that? Skin-to-skin contact. Are you from Canada? Duh. Now, this immediate undisturbed skin-to-skin contact just allows you and your baby to go through an instinctive stages. It's really nice. These include looking, of course, at you. The baby will just look at you, resting, and finally self-attached to the breast. I can't do this, but we learned this in school. The initial snuggling is also very important for the health benefits. We'll get into that in a second. So now here are 7 benefits of skin-to-skin contact. You got to remember this, guys. Number 1, it soothes and calms you and the baby, so that's pretty important. Number 2, your baby cries less. It does make a difference. And number 3, helps your baby regulate their temperature. Not that also, and their heart rate too. Really cool, right? Number 4, it helps your baby regulate their breathing and also their blood sugar. So when they're calm and collective, everything kind of just goes together. And number 5, it enhances bonding 100%. Number 6, helps your uterus shrink back to its regular size. We can't forget number 7, it's releasing of oxytocin, which helps produce colostrum for the female. I don't know why I did this like I'm the one producing it. So let's talk about how about proper and safe positioning for safe to skin contact. So number 1, you always got to remember you should semi-recline or upright and be alert. You can't be asleep when you're doing this. Number 2, your baby's in the middle and high up on your chest. Don't want to have them too low here. And number 3, your baby's shoulder and chest are facing you. Don't turn to the left, to the right, facing upright. And number 4, your baby's head is turned to one side with mouth and nose visible. So you got to see him and have, visible. Number 5, make sure your baby's chin is in a neutral position, not slouched, also called the sniffing position. Remember, their nose can actually get really smashed in real close, but they can breathe properly. Number 6, your baby's neck is straight and not bent, not like this, slouched over. You want them to breathe properly. Number 7, the baby's arms and legs are flexed in a tight to the side position, left and right, which is good, so you can move them over and over. Number 8, lastly, the baby's back is covered with warm blankets. You want them to be covered, warm, and definitely, touch-to-touch bonding is always great. So the skin-to-skin contact, let's just continue this video and discuss the best immediate start for breastfeeding, which is at this moment for the mother. And at the husband or family member, someone at the bedside, you always remember that babies should always maintain good skin color. They should always respond to stimulation, always. And babies are usually calm and relaxed during skin-to-skin contact. So remember that, guys. And also, you may get a little sleepy as well, but it's best to have an alert adult at the bedside to help out. It's important when you have someone there, right? Anyhow, my fellow nurse brothers and sisters, hopefully this video helped for all my pediatric nurses, L&D nurses, and also for my first-time newborn parents. Let's not forget all the registered nurses out there that are still learning. So my fellow nurse brothers and sisters, don't forget to subscribe, hit that like button, and share this video. Peace, love, advocate, and nurse grind. Deuces.